Hey there, sports psych enthusiasts. I'm Dr. Colin Fehr, and I want to share my passion with you. I love talking about ways to unleash the power of the mind. This recording is part of a larger lecture series I've created in an effort to make sports psychology concepts more accessible to a larger audience. The information contained in this series is especially well suited for students of sports psychology and is presented in a way that makes for easy listening for all. Welcome to Sports Psych Concepts.
Hey there, everyone. Thank you for joining me for this presentation. Today I'm going to talk about psychological responses to athletic injuries and dig a little bit deeper into this and the types of things that maybe sports psychology or mental performance practitioners should consider when they find themselves in these situations working with athletes. And it's something that I know I've mentioned previously. I say it quite often, is that many athletes, they get their introduction to sports psychology when they get an injury, but then a lot of practitioners on the other end of that, they actually specialize in this area because there's such a need. The challenges that athletes face are the psychological challenges are just so significant that there's some practitioners who specialize in this area, and they primarily work with injured athletes and helping them overcome those challenges. So I'm going to talk a little bit more about some of the psychological responses that athletes have to those injuries in this presentation. So the first thing I want to mention is just a broad concept when we're trying to understand what it is that's going on. And this is rooted in cognitive behavioral therapy theory, if you're familiar with that and you've looked in that, and I don't want to expound on it too much here. I just want to give you a basic formula for understanding how we might be able to categorize the responses that athletes are having, because really when someone gets injured, that it elicits complex psychological responses. Really, it's multifaceted. And so I'm going to give you a simple formula here, but understand that there's interrelatedness and interconnectedness, and there's other ways that you could look at this. So this is just one way I'm showing you. But essentially, if we were to try and capture in the simplest way possible those responses that athletes are having in a psychological sense to injury, it's going to involve three primary things: their thoughts, their feelings, and their behaviors. And there can be a range between those things. It can be things like, well, in the moment, there's the immediate shock that they might have, or there's just the pain component and those things, and then the short term right after that, and then they kind of come down from it a day or two later, and they met with a few specialists and practitioners, and then they're looking at long-term consequences. But either way, we can kind of categorize it into these three main things. So our thoughts, this is whatever it is that we're thinking. This is the cognitive component. This is going to affect how we feel, and it's also going to affect how we act. So it's not just this totally compartmentalized way of looking at this here. There's interrelatedness between these things, as I mentioned. And so the feelings, or the emotional component, the affective component that an athlete will have in response to injury, that will affect how they think, what it is that they're thinking, the thoughts going through their head, and then the actions that they take. And then their behaviors, what we do, will then affect subsequent thoughts and feelings that we have. Okay, so there's like I said, there's multiple ways that you could look at this in different ways and say, well, is it thoughts are leading to feelings, and then feelings are leading to behaviors, and then behaviors are going to lead to routines, and then that's going to affect our thoughts, and it goes through, is it a cyclical thing, or are they all kind of affecting each other? And so the way I'm presenting it to you is that they all sort of affect each other and can go back and forth. And so as practitioners, these are the types of things that we're looking at, because we could also pull in things like mood states, or just say stress, or it could even be chronic states like depression or poor rehabilitation adherence to what it is that they're doing. Okay, and so this just goes back to what I was saying. It can be hard to understand an athlete's psychological response because of those complexities and how it depends on so many different variables. And an athlete's response is is subjective and it's a little bit idiosyncratic, right? They've just got their own individual thing. And so I want to present this to you as like, all right, how can we simplify it, and the types of things that we're going to target and the interconnection between them. They have their different thoughts, what it is they're thinking, then they have the feeling component about that, and then they have their behaviors, the things that they're actually doing, and then we can use this and actually create interventions built around this. So I think it's important to have an understanding of some of the different models and approaches that are out there that we can use to try and understand injury and the different components, especially psychologically, that are involved there. And so Weiss Bjornstall and colleagues came up with the integrated model that's been around since the late 1990s, and there's different figures, different ways that you can capture this online, and you can look at it. But at first glance, basically, it's complicated. There's a lot going on. There's so many different factors involved that should be considered or could be considered in what it is that we want to target. And so this is what makes it difficult, is because we could have an athlete come in and maybe they're really the condition is the primarily the result of some sort of situational factor that might be a little bit out of their control, but maybe we're targeting a personal factor. We misinterpreted what it is that they're doing, and we're saying, oh, it's just their personality, or they have weak coping skills, or whatever, right? When in reality, there could be things that were out of their control. And so our approach will depend on how we're interpreting these different things. Okay, so this model, the integrated model, it provides a framework for understanding all of the different influences of these psychological factors on the sport injury rehabilitation process. Okay, so it depicts things that include pre-injury factors, okay, things like personality and their history of stressors and how that might play into their stress response. It could be their coping resources or different interventions that they have, things like that. Okay, so all of those are kind of at the core, because if we have high stress, we're more likely to be injured. Okay, but the core dynamic here, or cycle of the psychological responses, is derived from that transactional theory of stress. Okay, so understanding that stress is at the core, and so you have these different things that play into that, and then that are before the injury, and then we have how we may respond to the injury, which will include a number of personal factors, which would be their motivation, coping skills, history. It could be demographic things like how old they are, whether they're a male or female, right? Could be different physical things, the nature of the injury itself. And then there's situational factors like social support or environmental components that could be tied in there. Okay, so then we have this sort of fluid cycle that's presented in the model that again, it represents those responses to the injury, and then the associated outcomes. Okay, so we have they like, you have all of these different things, pre-injury things, then you have personal factors, situational factors, and then they have the injury. And so how are they appraising it mentally? Right, so back to what I mentioned before, thoughts. What are they thinking about it? Are making adjustments to their goals? What's their self-talk like? What is their emotional response, their feelings that they're having? And then what is the behavioral response, the types of things that they're doing? Are they sticking to their program? Are they removing themselves, or kind of aloof? Right, so the integrated model, even though thoughts, feelings, and behaviors are at the core of the model, it builds on that and demonstrates how complicated it can be, and how there can be all these other things that should be considered. So I want to raise your awareness of that by bringing it into the discussion here. So let's talk a little bit more about some of the personal factors from that model. So these really are those individual characteristics that the athlete's bringing to the table that will influence how they respond psychologically to those injuries. Okay, so this will include things that are psychological, or even socio-demographic, or physical biological elements, okay, those sorts of things. But you can tie in personality, history of stressors, what their mental health status is there. So you could do just like a mental status exam with them and see where they're at coming into the situation. How do they experience pain? Could be something. Their coping style, how motivated they are, or what type of motivation do they have? Where are they at on the spectrum of extrinsic motivation to intrinsic motivation? What's driving them? And that can be really challenging. If you think, I'll just give you an example on that. Like, they may be very intrinsically motivated to do their sport because they love doing their sport. And then now they're in a rehabilitation situation trying to rehab their injury, and they're doing these different activities that they're not intrinsically motivated to do those things. They don't want to sit and spin on a bike or do basic physical therapy exercises. They're not intrinsically motivated to do those for the sake of those activities. And so that's kind of an interesting thing to factor in here, okay? But I mean, we could go and talk about so many things, personality traits like optimism or hardiness, right? Or perfectionism. That's something that I've mentioned in other presentations that I've done, and how that factors in, right? Their previous stress, and if they have a predisposition to be more anxious, maybe they have more trait anxiety, or they have a tendency toward depression, right? Just their mood overall tends to be maybe a little bit of a downer. Perhaps they even have an eating disorder, right? So there's so many of these different things, and then with that they have their coping skills. Do they have more of a and we take some of this into consideration, but how much control do they have over the situation? And if they have a lot of control, are they using a problem-focused strategy? If they don't have a lot of control, then are they using an emotion-focused strategy? Okay, so that we want to match the approach, the coping approach or strategy with the situation. And so that's an important thing. So just a few thoughts on these personal factors. So now I want to expound on the situational factors that can be at play here that are definitely worth considering. And there's a lot of ways we could classify these, but essentially, the characteristics of either the physical or the social environment certainly can influence an athlete's psychological response. And these factors, it can include things that are related to the sport itself, or like I said, the social environment or the actual physical environment. Okay, and so we can classify these differently. We can look at their social support and say, well, are they feeling socially supported by their teammates, by their coach, by people that are involved in the actual sport? And then do they feel social support outside of that? Okay, because people can get social support from a lot of different ways. So they have a friend who's maybe not on the team. Do they have a sibling? Do they have a parent? Right? Do they have other people that they can talk to? What does their social support look like? And are they, maybe they had adequate social support when they were competing and they're performing, but now as an injured athlete, that looks different because those people they were getting social support from, maybe it doesn't look the same, or they don't know how to provide that. Okay, and so we can broaden that and say, well, here, let's look at the team specifically, or the coach, right? We can include medical support, so their athletic trainer or physical therapist, or even the medical doctor, those sorts of things. Okay, but there's other factors here as well. We can look at the sport type. Is it an individual sport, like tennis or cross country and track, those sorts of things, or is it a team sport like basketball and soccer and football, right? So that can affect the types of relationships that they have, and the support that they're getting. The level of competition also matters, because if it's a youth sport thing, even high school levels, maybe it's recreational, is it collegiate, like how much time, what's the level of competition? How much time are they spending together? And that can determine the type of support that they might get. And then you can also consider the timing of the injury itself. When did it happen? I had a basketball teammate in high school who went up and dunked a basketball, and it was the last drill that we were doing, In practice, he went up and dunked the ball and hung onto the rim for a little bit too long, so swung underneath and ended up breaking his wrist on the first day of practice of the season. The last drill that we were doing is the very end of practice. Ended up breaking wrist. That guy was actually my brother, but it was devastating because we pretty well lost him for the season, and he was a key player. So the timing of injury certainly can matter, right? Is it a crucial point in the season? When does it happen? What's the player's role on the team? Are they a starter? Are they a non-starter? If you're a collegiate athlete, how might it affect your scholarship status? Okay, so there's just so many different things that we could tie in here to where it's related to someone's social support. So you look at the scholarship status as an example there, right? It's like the coach still has an obligation to provide some support to the athlete, and the team does as well. But if they don't compete through the whole season, then they come back the next season, and is the coach still obligated to give them the scholarship? And there's all sorts of different ethical considerations on that, but but it's an important thing to think about. And you tie that into the timing and when it happens, and all of that. Okay, so there's just so many components related to situational factors that we want to be aware of. Okay, so I want to shift gears a little bit and go a little bit deeper on this, not too far down the rabbit hole, but when someone gets injured, it's a significant stressor, and it can lead to, like, it's a mental challenge just by itself, but it can turn into a mental health challenge where the athlete actually experiences poor mental health. And I can definitely speak to this from my own experience as a former collegiate athlete, and injuries that I dealt with, and how that can lead to feelings of depression and certainly fear of re-injury and anxiety. Some athletes get post-traumatic stress disorder because of the nature of their injury and how it occurs. If it's a traumatic, sudden sort of severe injury that they experience. And while not all athletes will experience severe issues like this, it's just the sport injury is certainly something that athletes would prefer to avoid, and they certainly would prefer to avoid some of the potential mental health challenges that can come with that. And so mental health support for injured athletes, what we're trying to do as practitioners is help them cope with the challenges as they're experiencing them, and then importantly, potentially even grow from the experience. And I'll come back and talk about that a little bit more, but that's one of those things that if we can not only get them and help them dig out of where they are in that low place and overcome some of those mental health challenges, but we actually want to see if we can help them come out on the other end even better. So for depression and depressive symptoms, as I said, these are really common among injured athletes across various sports and levels. We can go through the gamut down the list, and just feeling injured or getting injured, it can contribute to those feelings of loss and certainly isolation, and then just the sense of, the hallmarks of depression are a sense of helplessness and a sense of hopelessness. And athletes certainly experience that. The hopelessness piece is like, oh man, well, I got injured here in the middle of the season. Is there any hope that I'm going to get back before the season's over? And sometimes it's for good reason, because they may not, right? And so that can really be lead to a mental health challenge where they're experiencing those depressive symptoms, and whether that fully develops to clinically significant depression, there's a difference there. You'd have to have a clinician determine that, but the depressive symptoms are pretty common, and anxiety is often tied into that, right? They're thinking about whether they're going to return and what that means. Maybe they lose their scholarship, or they're contributing to the team, all that. So they have the depressive symptoms, and then anxiety can be tied in as well. And a part of the anxiety induction many times can be that just the fear of re-injury. I mean, this is a primary concern for injured athletes as they approach the return to play. and sometimes it can actually lead to reduced adherence to their rehabilitation program, or a slower return to activity. It's almost like a little bit of a self-sabotage thing, because they're so afraid of coming back, and they can't trust the injured limb or affected part of their body, whatever the muscle and the tissue is, and then that itself can manifest in anxiety and self-doubt and certainly avoidance, right? Many athletes, they'll walk away because of that. So it's a real challenge. And the post-traumatic stress disorder, or the PTSD, many athletes will experience those symptoms. And again, whether it's clinically significant to where a clinician would diagnose it, maybe that's a different story. But those symptoms can be real, just these intrusive thoughts or more extreme levels of avoidance after they get injured, particularly in response to the specific activity or type of situation that led to the injury. It can be a lot like athletes who are or individuals who get in a car accident, right? And it was a particular street where they drove, or a bridge, or whatever environmental setting, and then they can get back to driving, but they don't want to drive over that particular area because of the negative associations that they have with that. And so athletes can experience a similar response in the specific situation where the injury occurred. And so that can lead to that heightened sense of anxiety. They can mostly be doing okay, and then they get in the situation and they have flashbacks and all of that. Okay, so these are more significant concerns that practitioners maybe outside the scope of some practitioners if they don't have any sort of clinical background in these things, and so there may be a need to refer to more qualified professionals to help these athletes. So then with that, I want to reiterate things, because I know I've shared this in other presentations, and it's worth mentioning again because it's a real thing, especially when we tie in the mental health components that can be there. Okay, so if we present ourselves as a mental performance consultant or a sports psychology practitioner, and we're working with athletes and we're trying to help them improve their performance, and they're healthy, right? They're out there competing, they're practicing, they're training. The barrier to entry may not be as significant in that situation and how we're selling it. But when an athlete is dealing with more of a legitimate mental health challenge, that barrier can still be there, okay? Because there's just this lack of mental health literacy, where people aren't understanding necessarily even what it is that's going on with their experience. They just don't have the knowledge about mental health problems and the risk factors and symptoms and things that they can do for self-care. And so that low literacy can reduce the likelihood of seeking help, right? And then the stigma, of course, is tied into this. It continues to be a major barrier in different ways, because individuals will feel ashamed or maybe even reluctant to seek support. I remember an athlete that I worked with one time, where by the time she finally made it to my office, she was so worried and anxious about coming and meeting with me that on the way over, she actually turned around multiple times and started walking the other direction. And then she stopped, and she kept coming and came a little further, and then she stopped and she walked the other direction, like she wasn't going to show up for the appointment. And that happened multiple times. And I didn't find this out until the end of the session, to where she felt better and she was so relieved and she was glad that she came, because she almost didn't come. And it's related to what I'm talking about right here. There's that mental health literacy piece, but then also the stigma component that is still there. So what am I doing? Do I really need to go see somebody? I don't want somebody crawling around in my head, and all those components. Okay. And then the last thing I'll mention on this is the sport culture, because it is desirable in sport to be mentally tough. Like, mental toughness is an asset that athletes can use, and being able to persevere and work through difficulty and adversity, it is something that benefits athletes. Absolutely. And so then there can be this challenge where they're not feeling mentally tough and they're really having a hard time. And so, but then they're like kind of telling themselves they need to be mentally tough, but they're not really feeling it. And so they're not actually that way. And so they just will remain silent and then it can be harder for them to openly discuss the challenges that they're working with. Okay, so these barriers are real, and they're something that we need to be prepared for, and hopefully something that we can proactively work to address in our interactions with athletes and coaches and other important stakeholders. So I alluded to this earlier, and I want to talk about it more now, and it's just related to this idea that, are there upsides to injury? Are there things that can come from the injury that are actually good? Because, despite the negative challenges, which is a lot of what we talk about, and it's so difficult, and there's all these different things to consider, and the range of psychological responses that athletes have, sport injury, physical adversity, all those things, they can be opportunities for personal growth. Okay. And this concept I'm referring to is just the positive psychological changes that athletes experience as a result of dealing with that adversity. And so a specific term for this is called post-traumatic growth. It's been studied in various populations, including injured athletes. Okay. So post-traumatic growth. Really an awesome idea. Now, growth is certainly not guaranteed, as we see a lot of athletes where they're just wrecked, the injury wrecks them, and many times it can be a lifetime thing unless they do the work to get that resolved mentally in their mind. So there's not a guarantee that we have those positive outcomes, but it certainly is possible. And like I said, research supports this, and there's different areas where athletes may experience those different growth things. And so it could be things like, they increase their personal strength. They just feel more capable of dealing with adversity. They feel more resilient, okay, would be one way to describe that. They also can have improved relationships with others. You go through something that's hard, you have a connection with other athletes who maybe were injured, you have more compassion for them, and you have more connections to these different care providers that maybe you didn't spend as much time with before. And there also can be a greater appreciation just for life in general, or for new possibilities. Like, you can reevaluate what your priorities are. You can see new paths and look at things just differently because your perspective changes. You're kind of forced to change that. And then you exercise some autonomy and choose to change that perspective, and it can lead to even more growth. Okay, and so then there can be even spiritual or existential changes for people where they just develop a deeper sense of meaning in their life, and certainly a greater sense of appreciation for the things that they hold dear and that are valuable to them, and that's a big component. And one thing that I think about from my own experience is, as dealing with injuries in the past, is the knowledge and awareness that I gained by going through that. I learned a whole lot about the rehab process and how to recover from different injuries. I learned a lot. My knowledge increased, and my self-awareness increased of like what the limits of my mental toughness were, what the strengths were, and the limitations. Okay, and either end of that. And so all of these are potential upsides for injury. And so as practitioners, these are things that we can target with athletes and help them understand, okay, what are some other ways that we can look at this? Yes, this is a reality of the situation. We're still working. We want to get back and we have these goals. But what are some other ways that we can grow and benefit from the experience? And if we really focus on those upsides in injury, it can flip the script pretty effectively. And so then how do we facilitate that growth? And there's different things that we can target, and this is the last thing I'll share in the presentation. There's different factors or things that we can target with our interventions to facilitate that personal growth after the sport injury. Okay, and the first component is that social support, and I've mentioned all these different ways that we can categorize that and where it is, but we want to facilitate that. We want to target that. Okay, we want to provide that social support, to provide the validation and the empathy, and of course the practical help, because athletes do want tangible, practical tips and suggestions and advice to help them get through that. So we can simply provide that social support on a relational level, and that by itself can foster some of the growth. We also can help athletes process the experience cognitively, okay, just mentally on a more of an intellectual level, and help those athletes make sense of what happened and its ultimate impact on their life. So they step back and they just take an intellectual view of it, and maybe they even do some charting and writing and journaling and those sorts of things to reflect on it, and that is a way to facilitate growth for them. We also can help them develop coping strategies. This is a key part of it, especially early on when they're in it, and just helping them deal with it, because then those are things that they can use again in the future. And I don't just mean, future potential injury, which is a possibility, but other areas of their life, and we can help them make those connections with that. Okay, and then our interventions can also target emotional regulation. So we can challenge the negative thoughts. We can just view them for what they are, accept them, and diffuse or expand them. If we're using acceptance commitment theory ideas, we can identify positive aspects of the experience, like I was saying before, and help them regulate their emotions on that. Okay, and so again, I'm speaking from the perspective of a sports psychology professional and someone who works with athletes, and that certainly can be a part of this with a specialized skill set. But other support staff can also provide guidance and tools for navigating this recovery process to facilitate the growth. Okay, so we want as many different individuals and resources available for these athletes to facilitate that growth, because if they don't feel like they're getting the support, or they're able to properly unload how they're processing and their thinking, and consider different ways to express their emotions and then cope with it, then the likelihood that they successfully navigate that goes down, and we want it to be as high as possible. So that is all I have for this presentation. Lots of good things. Again, thanks for listening. I hope that you found some things that will benefit you in your world and what it is that you're doing, and we'll see you next time. Take care.
Thank you for listening to this recording in the Sports Psych Lecture Series. I hope you learned something. More importantly, I hope you learned something that you can apply in your life. Feel free to share this presentation with others who might be interested. And if you're interested in more content like this, visit the Fehr Advantage channel on YouTube, or find the Fehr Advantage podcast on Spotify, or visit my website at fehradvantage.com.